Hi, this is Cousin Consos. I'm Dr. Kendall Moore.
And I'm Dr. Durrani, and we are super excited to be joined by our special guest, Dr. Elizabeth Kazarian, a double board certified family and obesity medicine physician, a medical influencer that has hundreds of thousands of followers, and a true advocate for patients. Thanks so much for joining us today.
Thank you so much for having me.
There's
Thanks for the intro.
what did we leave out?
Probably not hundreds of thousands of followers, but like maybe one day. Thank you.
What?
No, yeah, so happy to be here. I'm talking to you from DC, and yeah, I'm a family doctor and I do obesity medicine, and I
Nice.
love the pit.
Yes, well, we are super excited for you to be here. I guess to just intro everything, how did you get involved with like social media and being like more public? Because obviously, like most of like our friends are very private. They go to the clinic or ER, come back, and don't post anything online. What was like your first foray into being a public person?
That started in residency in PGY3 and feeling like I had a lot of opinions that maybe didn't have an appropriate platform necessarily around me, in residency it's a job, it's about working, it's about learning, but it's hard, so I started expressing myself through social media, and then that turned into wanting to educate on social media like we do in residency. We do a lot of chalk talks and just made teaching videos. That was really fun. I was also that kid who made home videos like when I was younger, so filming and editing feels fun and natural, like a hobby.
Nice. And how has
Yeah.
how has like the journey into social media been? Has there been like, like any surprises, things you didn't expect, or like positive things, not so positive things?
It's a whole world. Like it's a whole new world starting social media. You don't know until you jump into it, but the connections can be incredible. The people that like your content or the people that start following you. Or like last week, the New England Journal of Medicine followed, and I was like, wow, that's really cool. So I think social media has cons to it, but there are a lot of pros. And I think one of the biggest pros is the community that I've found in social media. I've met a lot of people and a lot of doctors across the country that are also content creators and educators.
Yeah, absolutely. I'm curious about you, Kendall. You are, not I wouldn't call you an influencer. You like made an Instagram once we like created this podcast. What do you think of like people in the medical world who post a bunch about medical stuff and whatnot? You think it's like risky, not risky? Like what are your thoughts on it?
I think it's brave. I mean, I'm kind of a private person. I'm pretty sure you post a lot of good stuff. There's also some people that probably, I don't know about you guys that comment and disagree with you or kind of like pick stuff at you. I don't know. I'm just kind of a private person, but I do admire people that put themselves out there and make content because there's a lot of people out there putting misinformation. So to have physicians out there doing it is really great.
Yeah. I mean, yeah, I do get some like hate comments, hate DMs and whatnot, and I personally just ignore them. Like I don't think they impact me much at all. But sometimes I like arguing with people, so maybe maybe it's
Me
like
too.
for me. But what about you? Like obviously we all get like hate comments. So how do you deal with that?
I think at the beginning it was really hard. I'm not gonna lie. Because it's so personal in the beginning because you don't realize like, hey, they don't actually know you at all, and you have a public page. Um, so the key is just to not take anything personally. And I think your like skin gets thicker over time. Now it doesn't impact me as much, the hate comments, and I probably get more now, I think, as your account grows. Um, but no, yeah. I think I think you kind of get used to it. I think it's worth having a presence, even, despite getting hate messages.
Yeah,
Yeah,
100%.
yeah. I follow
Yeah.
you. I really enjoy your content. A lot of videos you post. I watched one of them where you were saying like how specialists sending everyone to the follow the PCP is always a thing, and especially in the ER too. I feel like that happens to us a lot. People get sent from the specialist as well, follow up or just things like that. I guess a question I have for you as well is that sometimes from the ER we discharge people and they go to follow up with maybe orthopedics for like a fracture. That's nothing's non-emergent. Sometimes they don't have insurance or they're out of network and they can't follow up and they get lost of follow up. So how do you, as a PCP provider, how do you deal with those patients or what do you think can be done to, fix that?
I- yeah, no, I think that's an incredibly vulnerable population in the US. And part of the emergency room pipeline coming back and back and back is because there is no segue to come and see me. We don't have that structure. That system doesn't exist. If you don't have private insurance, or if you don't qualify for Medicaid, or if you can't find a free clinic in your neighborhood, then you're out of luck. And there are a lot of those people who have to go to the emergency room. It's terrible.
I think we only have like what two city hospitals here in Houston. In New York, we had a bunch of them, so they would just find. I mean, it takes time to get into city hospitals sometimes, but in Houston, it's only two, and those things are always kind of like filled to the rim. I feel like.
Yeah, and then the other problem is that both of them are like in the medical center, which is like far away from like everything else. So then how do you expect people to like get there? And if they
Yeah.
get there, how do they get home? So it's just like such a logistical issue. Well, one other thing before we start talking about the pit, which is I guess why we're here, is you've like interviewed people running for Congress or current congressional people and whatnot. I have a poli sci background, so I really love that you do that. How did you realize that that was something important to have those discussions and talk with those folks? Because a lot of times we don't, but we'd love to hear about that.
Yeah, I think our jobs are inherently political, and I didn't realize that becoming a family doctor, politics were going to affect me every single day because policy that's made at the top trickles down into effects between, you sitting with a patient and discussing their accessibility to medications and affordability and everything like that. And so that's why I became more active online with wanting to educate the public also about the structure of our healthcare system and how lobbying and politics ties into all of that. And then I discovered that there's all these cool physicians that are running for government who want to change these things. And it's by following other people and learning from other people and discovering, I randomly came across Dr. Fisher in Chicago running for Congress. And I thought, wow, what a cool dude. So I followed him, reposted his video, and then he DM'd me and we were like, let's do a live. Things like that just kind of happen. And so I think one, it's creating educational content. Two, it's promoting people running for government who are physicians who inherently will have more of a sense of empathy when they are making decisions surrounding policy, like expanding Medicaid and not cutting it. Or and I think it's the way, and lastly, I think it's the way that I can do advocacy as well. Because I can't go to a protest. I work in clinic. Um, and so like my way of doing advocacy is promoting and creating like content surrounding people running for Congress who are doctors.
Yeah, 100%. Just like social media, like you and I can see 20, 30 patients in a shift, but
Mm,
like if a video gets seen by 1,000 people or 10,000 people, that's like it would take years for us to see that many people.
exactly.
Yeah.
Yeah. Isn't that cool though? We can like the conversations that we have behind closed doors with patients, just like the general themes of those conversations can be amplified to thousands, if not like millions of views. That's cool.
Yeah. Maybe us having this conversation will convince this guy to start posting on social
Do
media.
it. It's fun.
No,
It's time consuming. That's the negative part. It's time consuming.
I
Yeah.
went viral one time with a picture of my wife, and people were just commenting not nice things. I'm like, yeah, this is not for me. I can't. I don't have thick skin yet. Maybe I'll develop it, but I don't have thick skin.
Well, that's the thing. Like,
Mm,
I mean, you see my social media. I like post nothing personal. Like, my
yeah.
family's never on there, nothing like that. The golf's like the most personal thing I post, and that's not like personal. So you could just leave your family out of it, kind of
Yeah.
thing. Yeah. Well, moving on to the pit. Tell us about when the show hit your radar. Like, when did you watch season one? Did you binge it? And then tell us
Yeah.
your thoughts on season two so
I
far.
was late to the party, totally late. But I also like feel that I exist in a bubble when it comes to like new things, like new shows and music and stuff like that. So I'm always a little bit late. But then I kind of like I think when it got all the nominations for season one, like right at the like surrounding that time, and then I binged season one and then was like, whoa, this is a great show. It's been a while since we've had a really, really good medical show. Like, I don't know, the last one was probably Grey's Anatomy. Like we've got, it was time for another one. And I think this is the one. So I fell in love with it. And I think it's great because we're giving a platform and attention in the media, with like all the different kinds of shows that we do have to the lives that we have, that doctors have, that nurses have in one of the highest intensity settings, which is the emergency room.
Yeah.
I think it's a great concept.
What was your personal experience with the ER, like as a med student, resident?
Oh, I love the ER. I love the ER. Okay, this was my journey in med school. At first, I wanted to be an OBGYN, which is crazy because then I realized that I do not want to get up at 4 in the morning and do surgery in
Yeah.
my career. It's not me, actually. You have to be honest with yourself in med school. Like, you have to think, you have to realize, like, hey, this is going to be a 30-year career, you know? You got to do what you love. And then I thought I was going to do emergency medicine because I really needed variety and I like the fast pace. And then I realized, well, actually, being an emergency medicine doctor, you know, if you're going to be clinical the whole time, you never get to like really like sit down and have an office. Like that realization, like of having like an outpatient clinic office type of community setting, that's kind of what I was looking for, and that's why I ended up falling in love with family medicine. Because I thought in the long term, I think I'll be the happiest in doing that.
Yeah.
But I had to senior the pediatric emergency room and PGY2. I had to do like a month. I did like 2 weeks of ED nights intern year. I did a month of the emergency room as an intern, and then came back as a PGY2 and did another month in the adult emergency room. So, and then I've done like a bunch of urgent care within family medicine too. So I think it's fun.
Yeah, 100%. Respect to OBs. I have a close friend who's an OB, and like their lifestyle is insane. And I
I
think
think
that's,
they're incredible. They're superheroes.
yeah,
Seriously.
yeah. So I'm glad there's people doing that. So
Oh my God, we need more.
yeah. So
We
I'm
need
gonna
more.
pull up your clip.
Yeah.
This is a good one. I feel like it is perfect for the crazy stuff that happens in the ER.
A cast saw before? Of course you haven't. Well, today's your lucky day. Follow me. Dr. Mohan, you got a minute?
Yeah.
Have you met Emma? First day, new grad RM?
Hi. Nice to meet you.
Emma needs to learn cast removal.
How long's the cast been on?
Months, maybe years. Probably gonna want to breathe through your mouth. All right, Mr. Digby. Dr. Mohan can cut your cast off now.
How long's the cast been on?
I don't know, but it's really getting itchy.
Okay, this cuts the cast, not the skin. This should relieve the itching. Get the cast spreading. Look.
Thank you. Okay.
Oh, I see you brought some friends.
Oh my God, are those? Maggots. I'll need ethyl chloride spray to freeze them off.
Never saw that in nursing school, am I right?
What a good clip.
What a scene.
Yeah. So why did you choose this?
Haven't we all been there?
Oh, 100%.
Like, haven't we all been there? And it's like, okay, first of all, pick this clip. I needed a Dana clip because I'm in love with her. And we might need to edit this out later. I'm not sure, but she followed me on Instagram
No
like
way.
a week ago. And can I confirm? Is that okay with you? Can we take?
Yeah. You
Can
just
we
want to
take
make
a-
sure he's still following you.
Am I lying? Am I lying right now? That's so embarrassing. You're gonna have to cut this out if I'm lying. You have to.
It's a lot of pressure. I don't have that many
No, she's freaking following me
that's
on
pretty,
Instagram.
what's the actress's name?
Catherine Lanasa.
Yeah, that's pretty crazy.
She is
Do you feel pressured like
mwah,
when you see like the New York
mwah.
Journal of Medicine or her or like the other like the people running for Congress following you? Are you more like, oh man, what if I post this? And like, does that go into your thought process of posting it all?
No, I forget when I post.
That's a good way to think
Yeah,
about it.
I wish. No, actually, I don't wish. I'm glad I forget, right? You're supposed to be like yourself and keep doing what you were doing. For maybe that's the reason they followed.
Yeah.
I don't know.
Yeah.
But that was crazy. Maybe she accidentally followed. Maybe she accidentally
Yeah.
because I mass like all her stuff, so she probably accidentally followed me back.
No way. You
I
have,
don't know.
you have good content.
Anyway, had to pick this clip because one, I love her. I love her as an actress, as an actor. And her general attitude is like the epitome of the charge nurse that saves your life on shift. Um, and also the way that she educates, and then that scene in general is healthcare pushes you as a human being to your limits, taking care of other human beings. And even though, of course, maggots are gross, right? But what a beautiful thing to be able to do is to take care of someone else who's going through something like that. And I've had to take care of that in the emergency room. I've had to take care of scenarios involving other body parts with maggots. Things happen, life happens. And I think like this job, it just highlighted like how incredible this job is.
Yeah, 100%. And I think the expression on the nursing student, or she's not a student anymore, but the new nurse's face says it all. Like
Yeah.
everyone has that moment. All of us have had that moment where it's either in med school or residency where you're like, oh man, I didn't know this is what I was signing up for. But then
Yeah.
like your like duty to serve kicks in and you're like, okay, what are we doing about this?
Yeah.
Yeah, for sure, man. We've all been there. I've had a few of those. They used to use magnets to clean wounds back in the day. You can order like sterile magnets at some point to clean wounds.
But that was like a long,
Yeah.
right?
Yeah, I don't know how
Like
long.
we're talking about
Yeah,
1800s.
No,
recent. No, it was an order set for you can order it. I don't know how recent it
I
was.
think it's a thing. I think it's a thing.
Order sterile
Back in
magnets,
your
but
day, Dr.
yeah,
Moore.
yeah. But this guy, yeah, for sure. That's what we were talking about earlier. This gentleman, he probably came, had a broken like old radio ulnar fracture. They put him in a cast, and he was supposed to follow up, and he just got lost a follow up.
Yeah.
Like you said, he's been on for who knows how long.
Well, yeah, and that's like the problem within the system, right? Like you can everyone's like, oh, everyone has like I was literally like arguing with someone yesterday about this. It was like a let's just call him a person I wouldn't agree with.
Mm.
But they were like, well, everyone's like there's an access to care issue, but everyone could go to the ER and get access. And obviously, yeah, you can be seen. And so like this guy was probably seen at some point. He had a broken arm. He got
Yeah.
access. But then it's not access when you can't follow up on that thing or when you
Yeah.
the ortho or when you can't get the cast off and then you end up with a situation like this where obviously he's even sicker now and he's going to have like a skin infection and
Yeah.
maggots and God knows what.
It's
It's
gonna
a,
be IV antibiotics will be to be admitted. Those what are those things? Those cage, those external fixation things they put on ortho.
yeah,
Those things are always the worst. You always get home people come in, they're covered like garbage bags. They're always like dirty, not well kept. Those things are see those a lot
yeah,
because it needs a lot of care and they don't get the care they need.
yeah,
Mhm. Yeah, and especially if people don't have a home or they're sleeping on the street, it's really, really hard to find care as well as other basics.
Keep it clean. It's hard to keep it clean if you're not.
Oh, yeah.
yeah. The other thing I noticed, and it's actually true every time I've had a situation with maggots, is like the staff members a lot of times will freak out more than the patient himself, and that usually is the like reaction. Like the patient will be like, "Oh, that's not good," but like there's always like the one staff member, like a tech or nurse or a doctor or someone who's like freaking out more than the patient himself, which I think is interesting.
Might be embarrassed too, man. The patient sometimes.
Yeah.
Yeah, it's kind of rough. Yeah.
What
Yeah.
What's like for me, it is like if someone has like scabies or maggots or whatnot, that is the one thing that like makes me feel like, oh man, that's kind of like, gross.
Oh, I think scabies are worse than maggots for
Yeah,
sure.
yeah.
Yeah.
What's the thing for you? Like if you
No,
see
like scabies.
scabies,
That's the one. That's the one.
yeah, yeah. What about you?
I see bed bugs. I just start itching for some reason. Whenever I
Oh
see
yeah,
bed
bed
bugs, I
bugs.
feel like I start looking. I don't know. Even if I'm not close to, it, I just know I just start itching for some reason. They don't scratch me. I just feel like I feel like they're on me somehow. Because I'm
Yeah,
afraid if you get on them, they get on you. They're hard to get rid of out here. So
yeah, and apparently like you have to like clean your whole house and do all types of stuff.
you have to
Yeah,
throw your whole house away. I heard.
yeah.
I got scabies from the hospital.
No,
It was terrible.
yeah, that's like my worst nightmare.
It was terrible. Awful. It started happening and I was like, no way. This isn't real. This is psychogenic. I'm making this up.
Yeah,
And I was like, no, 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 this is really real.
and it was real.
Yeah.
It was so real.
Any other thoughts, comments on this clip?
No, it's just an unfortunate thing is I don't know how we can fix it, give people care,
Yeah.
Yeah.
Follow up is the issue, yeah.
Well, and like you said, this guy's
I know. Universal health care.
yes, that would help.
I know.
It's very simple. The
One payer system would allow that patient to come see me. Just saying.
And it would you know,
Save money too.
save money, right? Like, so you said this guy's gonna get admitted for IV antibiotics. He may need surgery. He may need debridement. He's gonna have
With
like
an ID consult.
exactly, which is gonna cost like hundreds of thousands of dollars. And if he had just gone like the normal follow-up, it would be like in a single payer system, like less than $1,000.
He might even he
Yeah,
probably remove the cash. He might even need surgery. He
yeah,
probably heal on his own. We know what fracture it was even.
Yeah. And how deep that wound is, who knows? He might have osteo.
yeah. I think we just solved healthcare. Awesome. Well, Kendall, this is gonna be your clip.
What do you think?
Well, I don't think it's cardiac.
I mean, what do you think of the app?
I mean, it's hard to say without seeing the full thing.
Take a look.
Oh my God. Do you know how much time this will save?
Studies show you can spend 80% less time charting. You'll get out of here sooner, improving both patient and physician satisfaction.
Oh, excuse me. It says here she takes Risperdal, an antipsychotic. She takes Restoril when needed for sleep. So is that,
AI. Almost intelligent.
Generative AI is 98% accurate at present. You must always carefully proofread and correct the minor errors. It's excellent, but not perfect.
This is amazing.
Okay, why did you pick this one?
I think before the season started, we were discussing like, what's going to be on the show. We talked about like AI because AI is like in every part of our life. And so like AI is like, it's not coming. Like AI is like here. It impacts all of us. We use something similar. Like it's like an AI scribe, basically it listens to your patient conversation, like forms a note for you. And this has happened to me before. Like it's good. It gives you a good placeholder, but it's not perfect. It doesn't give the correct history all the time, but it's good enough. One time I had a patient that was like cursing all the time. They put all those curse words in there. Another patient said she was in a really bad pain. It put seven. I told you it put seven reallys in there. So sometimes it does stuff like that, and it's just like it's cool, but it's not. I do miss the in-person scribe. I miss them having them sometimes. 'Cause, like if you have a trauma or something, you really like this. Our AI scribe, the patient needs to be in EMR to log them on to get the note going. And so if a patient comes in an emergency, you don't have time to put them in the system and like start the app. So I think having an in-person scribe was good for that point
Yeah.
in ER.
Liz, do you have any AI tools you use in your day-to-day?
Oh yeah. I use AI every day. I use Open Evidence has an AI tool like for all of my letters of appeal. You guys don't have to do that, I don't think.
No.
Right? No, welcome to primary care. No, yeah, and especially just obesity medicine, all of the appeals and prior authorizations and letters and stuff. So that's nice. Because it's also HIPAA compliant, and then like Docs GPT, the Doximity GPT has a scribe as well. Like that just listens to your to the rim. So you just have your patient be like, "Hey, do you consent to me using this tool so that I can make direct eye contact with you the whole time?" And everyone says yes. And there's lots of other tools that you can pay for, but I just don't want to pay for it because I think the Docs GPT one is like free. So
Do you feel like what they showed there, like and like Kendall was saying, like there's lots of hallucinations, like do you have to edit almost every note it writes, or some of them are good, or what are your experiences with it?
I think every note is about 80% good.
Yeah.
And that is a lot. That's like a lot better than me having to write the whole thing. So, you know.
Have you used like in-person scribe before?
Oh yeah, especially in the emergency room because I went to residency at UVA and they had like a whole scribe program in the emergency room, which was incredible. They were really good. I think if you're watching this and you want to go to med school, be a scribe in the emergency room. Like you learn a lot, and yeah, I have loved that as well. And it's fun because when people are just starting out being a scribe, you get to teach them a lot, and I think like being like teaching is fun. So.
Yeah, we had like a lot of our scribes were going to their college kids. They were getting ready to go to med school. I wrote some of them.
Yeah.
Patients even that got into med school, so it was a good training for them actually.
Yeah, it's crazy how like there's almost like this social aspect of it. Like you show up to shift and there's like all the scribes and almost every ER doc had one. And now like everyone uses the AI thing, so they're not there. It just feels kind
That's sad.
it is kind of sad because now it's like fewer opportunities for them to like learn and get like experience, or even know, like I think having a negative experience is also good, right? Like you say you're a scribe and you're like, oh God, the ER is terrible. I never want to be here. Well, that's valuable. You're not gonna
Yeah.
like
Wait. Are the writers going to watch this? Because you guys should write in a scribe character because that would be really great. Like an undergrad pre-med who's a scribe working in the cast. That
and
is a really good character. Like a
yeah,
long-term character who
yeah.
then goes off to med school. That'd be so cute.
Maybe Dr. Robbie will like get angry at the AI scribe because he does seem like a guy who's like set in his ways, and he'll get like a human scribe in
And
this.
then he'll get a college kid.
Yeah. Or maybe it'll be like his kid that he's kind of watching over. That's it.
Yeah.
Yeah, yeah.
Yeah. And then like mentors him to become a doctor eventually. Like, oh my God, we should tell them.
Yeah.
Guys, do it.
Hopefully they're listening.
No, I think the scribes, like the college kids that are scribes in the emergency room, are such a part. Like they play such a good part. They're so helpful.
Yeah.
Yeah.
What do either of y'all use any other AI tools, or like, so we talked about open evidence, we talked about like the scribe tools. Anything else you've encountered that either of you use?
No, I've heard of a few things I've not used. I heard that the Queen of Hearts, it kind of like reads the EKGs for you, which I
Yeah.
think can be helpful for like EMS and pre-hospital arrivals, but I've not used it myself, but only just the AI scribes, the only thing I've used so far.
Yeah, I've played with the EKG tool. It's pretty good. So, like, I mean, usually like we're gonna know if something is a STEMI or not. But I always like if I think it's a STEMI, a college STEMI, I always scan it on that just to see what it says. And every single time it said it's a STEMI. So it I mean, it gets it right pretty good, and that's impressive.
I mean, I use
Yeah. Wait, what? What'd you say, Kendall?
Gemini for sure, Gemini, ChatGPT, but I don't use
Yeah,
medical stuff though. I use them like,
Oh, yeah. Yeah, yeah, yeah. Well, beyond your typical up to date and Hippocrates, I do use open evidence a lot, like quite a lot, because it sources from NEGM and also the AFP now, which is great.
yeah, and I think ASAP has a agreement with them as well. So I think
Oh,
that's really
cool.
smart of them, like having those agreements in place with all the medical societies, because now we all trust it more. We're like, oh, it's like the same
Yeah.
as we would be looking, but it's way quicker. So I think it's nice. I think for like patients listening and whatnot, I think a lot of people think that like radiology broadly uses AI technology, which it does, I think, in certain specialties. But like in my experience, we don't use AI for radiology in any way in the ER. And I work at a few different ERs, and I haven't encountered it. I know there's like some like particular cancers and whatnot, like in terms of staging and whatnot, they'll use it for. But and I know like in drug development, it's like something that's very used very commonly. But I think there is a gap between, I think a lot of patients I speak with will say like, oh, are you using it for like, all your radiology, or like all of these like things built into like the EMR? Is it helping you like make diagnoses? And I'm like, no, not really. So I think there's a gap between like if you turn on like CNBC and they're talking about AI in medicine, people think like, oh, it's like revolutionizing everything. And it's definitely making huge strides in like the things we talked about, but it's also like not like the future.
mm, no, yeah, not right now.
No. I'm like, what are y'all talking about? Elon's saying that robots are going to do, like, first of all, we already have like robotic arm Da Vinci system for surgery.
Yeah,
Okay. So we have that. So it's already here. And secondly, are you saying robots will be the ones in control of the Da Vinci system? Because that's not happening.
yeah.
We're still, that's not happening in the next 5 years. It's not happening in the next 10 at all.
Did you
I
see?
don't think it's going to happen at all.
Yeah.
Did you guys see that clip? I thought that was insane.
Yeah, yeah. I made like a reaction video to it. I was like, if you're a med student, I was actually like a med student, a pre-med who had sent me that clip, and they were like, oh, should I like not go to med school? I was like, no, you should definitely go to med school as long as you're going to med school for the right reasons. And this clip, ignore it. Like there was like that guy,
Ignore it.
yeah. There's that guy.
Elon, sorry, what?
No, go ahead.
Elon's out here discouraging the youth. It makes me upset. Anyway.
Yeah. And I was just saying, like, there's a guy named Jeffrey Hinton who's like the godfather of AI apparently. And like back in 2016, he was like, "Oh, we won't need radiologists in 5 years. You shouldn't go to radiology
Mhm.
residency." And we obviously still have radiologists. They're still a super competitive specialty. And if you look at like the match rates from like last year, they're like top five. It's like we still have a huge need for them.
Yeah, I was gonna say that because it goes up and down. Like radiologist was down around that time, though I do remember, but now it's back and it's a very hot specialty to get into.
Yeah,
And yeah, and sometimes you do interventional radiology. You need a physical person doing those procedures so as well. Yeah.
yeah. Well, like, and even just imagine like we get imaging all the time, and I'll say like non-specific correlate clinically or something. What AI am I going to call at 2 a.m. saying, hey, this is what I'm seeing. When I press here, it's tender, or this is how the skin looks, or like this is their history. And then we have a conversation, and then the radiologist is like, oh yeah, it's probably like scar tissue. It's probably not
Yeah.
acute or whatnot. Like AI can't have that conversation with me. That's never going to be the thing. So like, yeah, I think these technologists are obviously
Right.
overselling.
Yeah.
Yeah. Okay, let me share my clip.
This guy needs an insulin drip, right? 0.1 units per kilo?
No, not without knowing his potassium. Insulin causes an intracellular shift, and if the potassium is under 3.5, the drip would kill him.
That is very true.
We can start with lactated ringers, 1 liter per hour until we get the results from the Chem7 and the VBG.
Why is he in decay?
Maybe he's not taking enough insulin.
More frequently, a precipitating event can be identified, such as pneumonia, urinary tract infection, stroke, myocardial infarction, pancreatitis.
Yeah, we always check for those. They're part of the standard order set. Right, Dr. Mohan?
Okay, well, I chose this because I think so this is what we call a gunner. So for anyone who's like not medical who saw this, and hopefully neither of y'all were gunners, but if y'all were, I'm sorry.
What's your definition?
Like the opposite.
Same.
What's your definition? I feel like that's different definition of a gunner. What's your definition of a gunner, actually?
So it's that. It's like undermining your colleague and trying to look better in front of like your attending or your professor by like outwardly saying like, oh, I'm gonna one up this individual by like showing I know more. Or not even like not being a team player. Like that's the basic definition, right? And so it's like, oh, you know, this professor or this attending said they're gonna hold like an EKG like informal hours, and you purposely don't tell the other student about it because you don't want to include them. So that's my definition of a gunner. What's your definition?
I had a different in med school. I guess it was somebody that was like really eager to try to please, always showing out, showing
Yeah.
class, going above and beyond. Not someone that was trying to like sabotage anyone else. So, but I got you.
Yeah.
Because it makes sense. Be a gunner means you gun other people down. That's why I just thought what a gunner was. But I had a different interpretation in med school. I wasn't a gunner, or at least I don't think I was.
You sure?
I don't think so. Now I was kind of quiet. I don't really talk too much in general, so I just
Yeah.
couldn't really say anything.
Yeah. And you said you don't think you were a gunner either.
I don't think so at all.
Yeah, I just thought it was an
No. I
dynamic.
would be like, guys, let's share all the notes.
Yes, that's how I think we all like it. Like medicine, and then now even as attendings, it is so hard to like just like be in healthcare. And so I don't think people need to be like competing with each other to put each other down and whatnot. But unfortunately, like it's a term that everyone knows, and every med school class has like I think like that 5 to 10% of people who are gunners. And I think it leads to like we all have like we talked about this last podcast, right? We have attendings from other specialties that we may not like interacting with, and I think the gunners turn into those people. Those are the people that were probably gunners in med school and residency, and then they become those people that are difficult to work with.
And you're also missing out, man. Like it's fun hanging out with people in med school, talking about stuff. If you're a gunner, no one's gonna hang out with you, be around you. So you're missing out on a good part of like the social aspect of med school, just being like that as well.
Yeah, 100%. So if you're thinking of going to med school, don't be a gunner.
I
Or
love the social part of med school. It was really important. Like your head is down, you're working really hard. You have exams every 2 weeks for the first 2 clinical years. And so in between exams, you have to have a group of friends to hang out with. It's impossible to just do it alone. Why would you do that? That sounds terrible.
Oh man, that best thing. Like we have a test on that Friday, every 2 weeks that Friday. It'd be amazing to get that Saturday, Sunday to go out. Sometimes we do it on Mondays, but those tests on Fridays, like you get to go out and hang out. It was
Yeah,
like
you hang out with your whole class.
yeah, that's like my to this day, my best friends that I'm in a group chat with that I talk with the most are med school friends. And we're like, it's crazy to say, almost 10 years away from med school, which is like mind blowing. It makes me feel old, but like the fact that that friendship and those friendships have lasted is a testament to like how much of a hard place med school is, but how much those bonds can be built.
My best friend from med school, I set him up on a date with his current fiance. They just got engaged and they just like called me and told me about it. And I was like, oh my gosh.
Nice.
So that was like 5 years ago. So yeah, no, I think you like find your best friends in med school.
Yeah.
because you guys can have the same lifestyle. You guys are all doctors. You guys are work in a clinical setting, so you have a lot in common with those people. So you think about it, when you're saying that, there's true to people I talk to, the most of people from med school, like guys I went to play ball with in college, talk to them every once in a while, but I talk more frequently to the people I went to med school with, actually.
Yeah.
Say that.
What I'm curious for you two, in terms of like your current work environments. And I guess we work together, so this kind of weird question, but like, are you friends with people from work? Like, we're friends, obviously, but like, like Liz, with you, do you hang out with like your work friends outside of work, or not really? Is it more of a professional relationship? I always wonder. I'm like, I don't, and I'm like, am I weird, or is it just like not a thing in medicine?
People have asked me to hang out outside of work and I've said yes, and then been like, wow, now we're friends. We're gonna do this again. So yeah, I have done that before. I
Yeah.
don't think that like I don't know if I'm bad at like initiating like let's go, let's hang out. So when people ask, I'm trying to say yes more.
Yeah.
And I've done that with people at work and I think it's been fun. I think it's great. And I'm also not in a hospital setting. There's so many people in a hospital, so you're like less, isolated. But out in community practice, like you can feel kind of isolated. So I jumped on it. I was like, yeah, sure, let's hang out.
Nice. Do you like through your various ER jobs, have you made like friends at work?
Yeah, for sure. Even here,
Yeah.
because I moved, I'm not from Houston
Yeah.
initially, so a lot of people I know from work, I hang out with them, with their families and stuff like that. We golf every once in a while,
Yeah.
you
Yeah.
and I. And then, yeah, people I work with on the locum trails too. We stay in contact with, especially they are in cities I like to go to. I'll go there and reach out to them, hang out with them as well.
Yeah. Nice. Well, Liz, what are you looking forward to for the rest of season two? What do you hope happens on this July 4th shift? What
Oh man. Yeah, July 4th. That's gonna be some crazy fireworks. We know that. Um, like injuries. And then I don't know. I'm kind of like I can't wait to see like how Dana's plot kind of develops more. Last season, she unfortunately had that scene that represented a lot of people in healthcare. That like was really just like a moment. Also had like a wave on social media of bringing attention to what healthcare workers go through any other job. You don't just get back up and go back to work. And so her character development, I think, started there. Her complexity, and I'm like looking forward to where it goes this season. What else is going to happen? Something big is going to happen with her. I'm calling it. I don't know what it is, but
You notice like she's not smoking anymore. She's chewing nicotine gums. She like must stop going outside.
yeah,
It impacted her. Like maybe she's afraid to go outside and smoke again. You know.
Yeah.
yeah,
Yeah, I hope we get to learn
good
more
catch.
like her life outside of that place because like
Yeah,
like Mel has a sister, about some of Robbie's things, not much, but some, like he's got that kid he's looking after and
Ankle
whatnot.
monitors and stuff. And
Yeah, yeah, yeah.
cousin.
And like with her, it's like minimal. You don't know like what kind of family she has, what her like anything. So I hope they explore that more.
yeah. I just know that she's so tough. Like there's her background story. I think it's on its way.
Yeah. What about the new attending? What do you think of her?
So I think she's a badass. Um, Everyone has their style of practicing medicine. It's called the art of medicine for a reason.
Yeah.
And she wants what's best for patients, absolutely. Um, do I think that she is the best at relating to people? No, I didn't really like. She's in a mentorship. Well, I shouldn't say mentorship because not everybody wants to be a mentor, right? She's in a leadership position as an attending. Um, and I forget who it was who says, well, they're in a deposition. What's her name again? She's in the legal.
Sister with you
Oh,
just
Mel,
Mel, yeah.
Dr. Mel.
Yeah, sorry. When Mel says I'm in a deposition, and Dr. Al Hashimi goes, well, I've never been in one of those, so I don't. That's like the opposite. Even though that's true, that's what you don't say to someone in that moment, especially a student or not a student, but like a mentee power dynamic situation. So I think she's a great doctor. I didn't like how some posts were on social media were kind of demonizing her. I think we easily do that to strong-willed, outspoken female leaders in general, like physicians, CEO levels types of female leaders. So I'm very hesitant to, you know, give her any negative comments at all.
Yeah. Yeah.
For sure. If you have like any like thing to say as a woman, you get demonized. The one thing I'll say about her though is that like I don't think she should work in academic medicine. Like we work in the community, and I feel like she hinders some of the residents like learning because she wants to just do a lot of things. And I feel like she's like kind of Robbie's kind of like, what do you want to do? And she's kind of telling them what to do. As a resident, you want to be formulating your own ideas, and the attending's there just to kind of stop you from basically killing someone.
Yeah.
And I feel like she's kind of just telling them what to do. So I feel like as in an academic setting, maybe she might be benefit. She may benefit more to be in a community setting like we are. 'Cause we don't have residents. We kind of do what we want, and we're not teaching because I like doing my own procedure. I like doing intubations and like chest tubes and stuff like that. And so It'd just be hard to kind of get in the way of residents learning sometimes, I feel like, by doing those things.
Yeah, no, I was literally about to say that. I was like, so they're portraying an academic medical center, and usually at academic medical centers, the interactions are like hers, where like everything is a teaching opportunity. There's like, what are you doing next? It's you talk through everything, and Robbie's like a community doc. That's what you would expect from a community doc, where you're wearing like the hoodie and you're just kind of flowing around, you're doing your thing, and everything's not like an academic exercise. And so it's interesting that they portray him as the lead character in the academic medical setting, where of course there are folks like that in an academic ER, but like they're a rarity is what I would
I think
say.
he's great though. He says, "What do you want to do?" And then like give him answers. If there's something wrong, then he'll correct him. No, but with
Yeah.
her, she's kind of like saying, "No, this is what we're gonna do," not giving you a chance to think for yourself sometimes.
Yeah. Do you work with residents, Liz, or no?
No, I can't. I could if I wanted to, but I haven't taken on any med students where I'm working right now. But it's something that I would love to do moving forward. I just finished residency. Like I'm in my first year out of residency, so I didn't want to like do it like take on a student too soon. But now that I have my bearings, I think having a student in clinic would be really fun, especially like a pre-med or even a med student, even having a resident or something.
Yeah. I'm such a control freak. Like I would have a difficult time like letting go because you have to like let go of control if you're gonna have a resident because they are gonna have to do a procedure to learn, obviously, or
Yeah.
do their own tests. And I'd be like, oh God, I have to like double check everything and whatnot. I'm like so OCD, such a control freak that I would have a hard time doing that.
I had the best attending watching over me do my first lac repair in the emergency room, and it was a dog bite. And it was just like it's such an incredible memory because they were so patient. And like, the kid was sedated and we had time and it was in the middle of the night. And it's just one of those, and it's just you and your attending and the parent and the kid. And it's like one of those core memories from training.
That's good. That's how training should be. It should be a pleasant experience and not
It
traumatic.
should be. But then of course we all have those other moments where we're like, whoa, wish I hadn't learned it that way.
Yeah, 100%, 100%. Well, thanks so much for joining us.
Yeah.
Amazing to have you. Where can people find you?
Well, I'm in Washington, D.C. I have a clinic in Arlington and Falls Church. And then I'm also on Instagram at Dr. Kazarian.
Yes, follow her. Good follow. Well, thanks so much for joining us.
Yeah, thanks for having me. I look forward to reviewing what's your content.
Yeah. And we want to see you posting more as well.
That's one thing, yeah. I'll make one.
Awesome. Well, till next time, folks.
Yeah. Till next time. Bye.
Thanks for joining us for another episode of Cuts and Consults. It really helps us if you like and share this episode or any other episode with your friends.
And if you'd like to be a guest on our show or if you have any feedback, please hit us up. Again, I'm Dr. Moore and
I'm Dr. Durrani, signing off.